kind of...
I'm speechless. I knew that 2021 now put us on the offense, but I've seen the joy, I've seen the tears on these people's faces. It makes me happy to be able to serve them and to offer them some hope that we'll get back to reality. Hopefully, if not in the end of 2021, by 2022. But to listen to her and the joy she had and her trust and faith in not only vaccines, but in the health department, the nurses that she works with, was very gratifying for me. I don't do it for the praise, I don't do it for the gratitude, but to be able to sit and listen to that just made my heart swell. I do it to keep people healthy, obviously, but to hear the gratitude and the happiness in her voice and to have such a great community advocate for vaccination is really awesome.
I was amazed when we walked in there and the applause from the staff. It's obvious that this meant a lot to them too.
It does. They've been working very hard and they are upbeat, they're welcoming, they care about people, and they do that day after day, 5 days a week for from 500 to 900 people per day. So I'm gratified to know that the people I work alongside have the same feelings that I do. And I think that's why this clinic has been such a huge success, because we do care, we do take the time, and we do appreciate every single one of the people that we serve here. It's amazing.
You know, you would get the feeling out there, it's possible to get the feeling by watching the evening news or whatever, that the vaccines just aren't going into arms. But when I see this number, and coupled with the fact that right now, better than 140,000 people in Kent County, 140,000 Kent County residents have already received a dose.
Right.
That's, we're moving.
We are moving, but we are moving with the vaccine that we get allocated. And it's true that across the state of Michigan, there hasn't been the allocations we would like. You know, we're a partner in the DeVos Vaccine Clinic downtown. It's my understanding they have the capability to do 20,000 vaccines a day. We don't have that vaccine. So yes, we are doing a wonderful job, but we do have the capacity to do more all across this county, not just at DeVos, but with our other community partners. You know, our federally qualified health centers, we have Metro, we have Mercy. They have stand-up clinics as well in different locations. And I think that's how we're going to reach our community, not just here, not just at DeVos. And we have a partnership that we're working together so we don't step on each other's toes. So we see where the gaps are, where the people that, you know, can't come or don't have the transportation. And I think we have a really robust plan. It's just that the vaccines have not been there in the amount, but we certainly have utilized every single dose that they've given us. Hence, as you said, over 141,000 people. So it's been a long haul. We've been doing it since probably the first part of January. When you think about 5 days a week here, that's a lot of vaccines in less 36, 37 days. And we're committed to doing that as well as doing outreach events in our community. So we're going to keep working hard. We're going to keep using the vaccine that we have. We just ask that you be patient until it's your turn. I know it's frustrating. I know people want the vaccine. And as Shelley said before me, it's not a magic bullet. We still need to socially distance. We still need to stay home if we can, wash our hands, wear our masks. There's some talk now about wearing double masks out with the new variants that are in the community. So we can't let our guard down. We're in the beginning of the end, hopefully, but we're just not there yet. So we just need to keep doing what we are doing. Sign up for those vaccines when you can. If you are in the community, you go to church, you go to grocery stores, you know, be a good example for others, but then also talk up the vaccine. You know, how important it is that we all take care of each other as a society so that we can get back to normal.
So something to celebrate, but we got a ways to go.
Right. But how nice, you know? I know I was dose 1 at the county, so I was so happy that I was here to share her joy in 20,000. It was a great Friday to celebrate for sure.
And now, looking forward to dose number, I guess it'd be about 700,000.
Right.
Countywide.
Exactly.
And really at 150,000,
Yes,
not bad.
not bad.
We've probably never done a greater vaccine campaign in history.
I don't believe we ever have done this. This is one of the biggest vaccine campaigns in history because
Yeah, it's got to even outdo what would be the next biggest, probably polio.
polio was huge. Now, granted, I wasn't part of the healthcare workforce at that point, but the biggest one for me was H1N1 in 2009, and that was finite. You know, that had an endpoint to it. And I see this as getting bigger and bigger. And the other thing was for H1N1, we had one vaccine. You know, we are going to have a lot of different vaccines for this campaign, which has implications for the healthcare workers. Many of them have different storage, different handling requirements, different doses. And also, I think for our community, it's going to be whatever vaccine is available at the clinic you're at, that's the vaccine you're going to take. And we wouldn't give it to you if we didn't think it was going to have a good efficacy, if we didn't think it was going to work. But there will be many different choices, which is a great thing, actually, because that increases our vaccine supply.
But I don't get to say, I want a Ford, I want a GM, I want a Cadillac. What you get is a car.
That's right. Exactly. That's exactly right. You're getting a COVID-19 vaccine shot, and whatever we got allocated for the week or the next 2 weeks, that is the vaccine that we'll be using. Right.
All right. Excellent.
Okay.
Start zipping it out here.
Okay. Oh my God. I would like